Our last, awesome, thank you, Joy. It's our last call of the year. There's a lot to celebrate that's happened in 2023. And one of the things that I felt would be a great way to kind of kick off our last call of the year, and really was inspired by our team in Georgia, Rachel Hoyer and then Krista Lee Polk, was grateful to be invited and be able to attend their Georgia kickoff meeting. But I really love the way that they started their call by sharing our why. And I think it's important that to go back to sharing, why it is we're all here together and why it is we're pursuing so everybody can move, and kind of share some stories that are really the heart and soul of this initiative, and what is really resonating with legislators as well. And so I've invited two of our advocates, Christine McMahon and then Linda Fisher. Linda's from Georgia, and Christine was part of our incredible team in Colorado and is soon to be moving to Michigan. So we're excited. That's a good strategy, just to let everyone know, like, if you can be in one state that's working on a bill and then move to another state and enact it in another state, we would love for you to do that, because that's pretty effective. So I'll pass the mic over to Linda. She's going to share her story of her limb loss journey and challenges with access. And then Christine's going to share her and her son Braden's story. So off to you, Linda.
Okay, thank you. And thank you to everyone what you're doing for this cause and for this worthy endeavor. I am from Georgia. I'm about an hour. I live in Tifton, which is about an hour north of the Florida line. So if I have a little Southern accent, that is true to who I am for sure. I live a very active life with my family. Have 4 children, 3 boys and a girl. No D1 athletes, but we always had a very active family. That is who we were as a family. We've been backpacking, hiking, snow skiing. We ran a family marathon relay. It's just an integral part of who we are as a family. And so my 18-year-old daughter and I were training together for a sprint triathlon. And we were out for a 12-mile cycle ride one morning, and that's when tragedy struck. And we were safely cycling, and we were struck by a full-size truck. And while I don't remember getting hit by the truck, what I do remember is kneeling beside her lifeless body and trying to breathe life back into it, and praying over her and just doing everything to will life back into my precious youngest child. So they took me away, and of course I was injured from head to toe. And for the next 3 years, just tried to get my broken body back together. I was injured from head to toe, and my worst injury was my left talus that was shattered in the accident, and my ankle bone. And so I was off my feet for many, many months, and I fractured my back as well. There were just multiple things that were wrong with me, as you can well imagine, being struck by a truck. But I had a lot of joys during that time. My 3 boys got married, and so I have 3 additional daughters to love and who have loved me very well. But I also had some more heartache as my husband of 30 years walked away from our family. So that was just another loss. So I had the loss of my child, the loss of my marriage, and then the loss of my health. So I was reeling from so many different aspects of loss. And so after 3.5 years of 24/7 pain, and 3 surgeries that would help me get a little better, and then I would just get worse again. I sought out more and different doctors. I went to Nashville, Tennessee. I went to Duke, and I said, can you fix me? And if you can't, will you please cut it off? Because I cannot deal with the pain. And so after meeting with those doctors and having a FaceTime call with my children, many of whom are in the military, all over the country. And so we collectively decided that is the best for the quality of life that I was seeking. And that has far been the best medical decision I have ever made. And so just being able to have that peace of mind knowing this is right for me. So I entered physical therapy again, just learning how to walk again, because in those 4 years, 2 of them, I was completely off my feet, whether in a wheelchair, crutches, or scooter. I was only walking half of that time. So I had to learn how to walk again, but I was definitely embracing this new life. And within 3 weeks of getting my prosthetic, I was on the treadmill running at physical therapy. And I was so excited. I remember wiping my brow and turning to Mike, my physical therapist, and going, "What is this wet stuff?" I had not had a good workout in such a long time. And so I was just so excited to be able to move and to have a good workout again. At 5.5 months, I was able to be on the ski slopes with my children at Park City. And I was just, as I was regaining my skills, though, I didn't realize the trauma that we endure with something like I had gone through, that it would just ambush me on the slopes. And so I skied the bunny slopes just fine, thought I was good. And before I knew it, I was just frozen in terror on the side of a mountain. I was just concerned, what if someone hit me? What if I got injured again and I was in pain again? And all that just kind of comes and reeling back, and your brain is just hypersensitive to your surroundings and situations such as those. But the next day when I was on the slopes, it was like I was the president and my children were Secret Service. I had a kid in front of me, a kid behind me, and they were flanked all around. And there was no way I was going to be injured. I was safe within their care. And that was last Christmas. And what has been so good, last Christmas when we were out there together, my oldest son is stationed there. I was able to be mom again. I was able to be who I wanted to be in our family again. I was able to stand up in the kitchen and to cook with them and to go skiing and to play games. And they weren't waiting on me. I was waiting on them again. And it was just wonderful to regain that part of my life back again. I currently see Andrew at ProCare Autobot Care in the Atlanta area. And he told me of the CAF grants for running blades shortly right after I got my prosthetic, because the deadline was due, and he said, "You need to apply." And so I was awarded that, and so thankful for that. And I took that home in August of this year and immediately signed up for my first 5K. And so I went back to PT to learn this new gait, which I call a KitchenAid, bread hook, basically, that you're learning to run on again. And I'm just ready to learn how to run with this and regain more stamina, regain more balance into my life. And 3 months later in October, I ran with Andrew from ProCare and Mike, my physical therapist. They ran right with me. My 5K here in Tifton. I have a really amazing medical team I'm very thankful for. And so just as a group, as we look, what we need to accomplish, we always have to remember that story behind the amputation, the story of sickness, of trauma, of loss, and of tragedy. And of course, for me, I will miss Sophia every single day. I will miss not being able to finish that triathlon with her. I'll miss the fact that I never got to see her get her high school diploma or help her plan her wedding. But what I don't want to miss out on is the rest of my life. And I don't want to miss out on the life with my children and the life with my grandchildren. I have 2 on the way, so I'm super excited about that. And so that is very important, to be active. And being active has been the catalyst to giving me my life back. Not only has it helped with my body, but it's helped them in my heart. And while I will always miss my sweet little redheaded, sassy teenage girl, my physical strength has enabled me to just move forward while I've been missing a piece of my heart. So I appreciate you allowing me the opportunity to share, and I appreciate all the work that y'all are doing in your various states for this movement.
Thank you, Linda, so much for sharing that. I'm going to try not to cry, but of course I always wear my emotions on my sleeve because this is such a personal initiative, and to many of us, the challenges that we've gone through when you talk about the trauma and the pain of healing. So thank you so much for sharing your story. I think it's always so important for us to remember that when we ask people with limb loss to share their stories, we're reliving that trauma all over again. But your story is so powerful for this initiative, and really appreciate you using that story for good. And like you said, your story and so many of our stories are the heart and soul of this initiative. And it's so important to put that out in front and center, because that's what is the driving force for what we're doing and how we're going to change hearts and minds for this legislation. So Thank you so much for sharing that, Linda. And Christine, would love for you to share your and Braden's story as well.
All right, well, that one's going to be hard to follow up. And thank you, Linda, for sharing your story. It really is, motivating to see people go from trauma to really like using it for good of all people. And it's truly amazing. And it's honestly, part of the reason that I'm here. My son was born with fibular hemimelia, and which is the absence of a fibular bone in his left leg. So it wasn't really quite due to trauma or anything like that. It was just a congenital thing that happened at birth. And so at 11 months, we actually chose to have an amputation done at the Shriners in Salt Lake City. And then shortly after, at 13 months, he was walking on his first prosthetic leg. So it was quite the whirlwind. And
Man.
we we really turned to social media, honestly, because there wasn't a whole lot of resources out there. And it's when you find out that your, child has something like this and you have zero idea about anything like that. That's why we really turn to social media. And, people can say all the bad things they want about social media, which there is bad things out there, but it has enabled us to create this amazing network of people and an amazing resource connection for us. And so kind of throughout our journey, he went to Shriners in Salt Lake for a while. And then, we switched over since we were living here in Denver over to Children's Hospital here. He had an 8-plate surgery at about 3 years old. And then, after that, I really started to look into, what are his options? Like as he grows, how does he remain active? He was in karate. He likes to play soccer. He likes to do all of the things little boys do. And, there are a lot of, barriers to have him be his best self, right? And so, getting a running blade is really one of those things. And so I started looking around and, we had reached out to CAF, and we did get awarded a grant in 2021. And we were like, this is great. We're so excited about it. Our prosthetist had actually filled out the paperwork. And I don't know if it was just kind of the communication breakdown between my prosthetist and the vendor or what happened. And of course, they work with so many people. And so I'm not bad mouthing anyone. So some things just fell through the cracks. And we had gotten involved in the legislation here because it was near and dear to my heart to be like, hey, it should be medically necessary for everyone to move, regardless the age, regardless of what happened to you. You should be able to move and to have the best quality of life that you possibly can. And so, I had reached out actually to Nicole through social media, and I was just like, hey, would love to bring legislation that you posted about Maine here to Colorado. And then, 2 weeks later, I am talking with Angela and, we're brainstorming ways of making this happen. And because of those networking things though, and going through legislation and getting everything approved, I was very honored to help out with the RMOPC fall educational conference. And so literally it was the right people at the right time. I was talking to some of those vendors, and whatever had happened with the communication to get our running plane, it magically happened. And a week later, Braden had a running blade at our prosthetist office, and just yesterday got the whole thing back, the finished version. And I've never seen him so excited. It brought tears to my eyes because he looked at it. He was literally in awe, and he's kind of shy before he really gets to know somebody. And we walked out to the car, and he was like, "This is awesome." And it was just a whole thing to really make it full circle, because that's what we're fighting for. And if we can make it a little bit better for each and every person through the legislation that we're all doing, and just being those advocates, I mean, it goes a long way. And I think that, being healthy as a child will only help them, as an older adult, instead of being sedentary, they're going to remain active because they can. And that's really what we're fighting for. So that's really our why. And if you want me to share my screen, I can actually bring up the little reel I did from Instagram if you want, but it's a really cool leg.
That would be awesome. Joy, can you give Christine screen sharing?
Yep, should be good now.
Awesome, thank you.
Let's see. Mm. Can you see that?
We can't see it.
No, okay.
Oh, now we can.
There we go. Okay.
Let's load in.
So this was him running yesterday on his new one. And it's so funny. This is literally the second time he's ever put it on. And he was just so excited about it. He wouldn't stop running the hallways. And it's a pretty cool leg. So
That's awesome. If you wouldn't mind dropping that in the chat too, so people can watch it or follow you guys on Instagram, that would be amazing.
yeah, definitely. And we have, just because of all the resources that we had starting out on this journey, we did make an Instagram page just to really talk to other families, and it's really helped. I mean, just the resources that people have, and I mean, just me reaching out to you saying, hey, we're moving to Michigan. I know nothing about prosthetists or adaptive communities in Michigan. I mean, that's a huge thing too. And so it's definitely worth us all being resources for each other and keeping in contact. So that's how everything gets done, is communities like this. And hopefully we can bring legislation to Michigan, and really excited to help that team and hopefully get it across the finish line as well in a year or two.
Absolutely. Amazing. Thank you so much, Christine, for sharing that. And I think both, what you and Linda shared, I think is so important to remember. It's fantastic that we have charities like CAF and Wiggle Your Toes and so many others that are, filling this critical need. But, to ensure that this can be equitable for everyone and that everyone can have access, and that it's a right for us to have it, that's the goal of so everybody can move, to make sure that this is within legislation, and that individuals don't have to sell their stories or know the right people at the right time or the right network to get access, and that we can, just go to our healthcare within the healthcare system, go to your prosthetist and get access. And I think an important part of that too, and kind of the unsung heroes behind the scenes, are really the prosthetists who are providing this care, pro bono as a result of this not being reimbursed. So just want to give a shout out to all the prosthetists behind each one of us that empower our own mobility, and who are, part of this initiative, leading the charge too. So thank you both for sharing that. I think that really helps ground us, and is an amazing way to end the year with your stories. So thank you for that. And want to point out Jeff Kane's comment that Braden was a secret weapon for Colorado. So for those of you in other states, definitely something to consider, obviously involving children, and, finding a secret weapon of your own. Linda, I definitely think you will be that for Georgia. So I know the team's really excited to have you. So the next part of our agenda for today is to do a little 2023 year in review. So I've prepared just a brief presentation and some photos to kind of celebrate where we've been over the past year, and a little bit on kind of where we're going. So of course, I want to say that I'm not going to hit everything that's happened over the past year. There's been so many incredible successes, and I want to thank our partners at the Amputee Coalition, the National Association for the Advancement of Orthotics and Prosthetics, and the American Academy of Orthotists and Prosthetists. This initiative wouldn't be possible without all four of us coming together as these national entities to help support this. In addition, of course, to all of the incredible grassroots advocates that are really the ones leading this effort. So just some highlights kind of through the year. One of the big items that was kind of came as a theme is that really kids led the way for this initiative, and just to honor where we started with So Kids Can Move. Thanks to our incredible advocates and you all being willing to, push the envelope on your legislation and try new things. You all were able to get, this legislation to be covered more than just kids, but for adults as well, to expand that. And we've seen that successfully now in 4 additional states, and all of the 4 that have now joined Maine are now for all ages. And because of that effort and seeing how successful that was, we've been able to take from So Kids Can Move to now So Everybody Can Move. And of course, with that, we did a rebrand, which we were excited to reveal a few months back, and then setting our vision and our mission statements to create equitable and life-changing access to orthotic and prosthetic care for physical activity for individuals with disabilities. So we're really excited to now use this brand as we're moving forward, and our tagline, Empower Through Movement, to really communicate the importance of access for orthotic and prosthetic care, and excited that this is now for everybody. And I think if that wasn't clear, the everybody part of that is really making sure that we're, talking and bringing this initiative in relation to the disability community, and that everybody, no matter what disability you have, deserves access to mobility and independence and physical activity. And we've also seen incredible success across the states. So what started as one with our team in Maine, led by Jordan Simpson, has now really turned into this national movement, thanks to all of you. So we've got 5 states now that have enacted legislation: Maine, New Mexico, Colorado, Arkansas, and Illinois. Kudos to the advocates and team leads there. And then 5 additional states that have introduced legislation, including Minnesota, Indiana, New Jersey, Connecticut, and New Hampshire. And then, as you can see, across the country, many more interested states. And coming up in 2024, we're slated to have around 12 states total have legislation introduced. So excited to see where this is going. And of course, all of you guys on the ground, these are some kind of photos from the past year. And I think it's incredible to think about the successes and wins that we've had beyond just, having a bill enacted or legislation introduced. There's so many things that you guys have done on the ground and have mobilized as advocates that are incredible wins just for our community in terms of education and awareness. And when we've come together to, bring our voices to the table, there's some successful things that are coming out of this. So just want to give a kudos. There were many photos in a few states that I left off here, but want to say thank you guys so much for all the work that you've done. And you guys also own the spotlight. I think we've seen some incredible media coverage on this. And if any of you guys haven't had a chance to see these videos or news pieces in New Mexico and Colorado, I'll highly recommend it. They'll be on our website shortly, so you guys can have access to those. But just want to say great work to the teams who've been able to secure this media coverage, and saw something recently, even in New Mexico, with Little Hope and a piece from Hanger News, and the news station there that continues to follow her journey. So it's something that's even living on well beyond the legislative sessions. Something that we did internally this past year is really doubling down on our resources to provide to all of you, whether that's been our advocacy and lobbying toolkit, and shortly we'll announce our state coaches. These lead advocate calls that we've done, whether it's speaking at events, or kind of bringing other awareness to help you recruit more advocates to your teams, our branding guidelines, logos, fiscal and social impact reports, and more. We definitely want to be supporting all of you to be successful. So if there's anything in terms of a resource that you have not yet been able to have access to that you need, we are here to help create that for you and help share it across the states as well. We also raised some funds this year, which I'm very thankful for many of you who were part of these events or fundraising activities. We're just getting started, and we'll soon have a 501c3 that we can dedicate for So Everybody Can Move. But over the past year, we raised over $100,000 and have been able to put those funds back to use in growing the initiative and supporting states, whether it's been through our website or photo assets or film, but also our consultants who are now helping on our implementation side as well to ensure that states who have implemented these bills are going to be able to successfully lead the charge and get access within the state. I want to give a shout out to our Hood to Coast team. 75,000 of the $100,000 that was raised by this team. Thanks in part to their fundraising efforts, but also our partnership with ON and the Right to Run Social Impact Program. So I want to thank this team of adaptive athletes who shared their stories and shared the cause with their community. This is something we won't be doing Hood to Coast again in 2024, but are looking for other options and other ways to fundraise and have events that can bring about bring the community together, but also to fundraise on behalf of So Everybody Can Move. I also want to give a shout out to Nate Kappa and Abby Sanchison, if I'm saying her last name correctly, from Bremer Prosthetics. They partnered with So Everybody Can Move on their Step Up to 5K event that they hosted this past year and raised $10,000 for So Everybody Can Move, which was very significant. So thank you all. Thank you, Nate and Abby and Bremer Prosthetics, for your support. And if anyone else is interested in doing something like this, we would love to partner with you all on that to support So Everybody Can Move. And then what's in store for 2024? Well, we've got a few goals, and these are just a few to name. We've got many more than this, but I want you guys to know that we'll be launching the website coming in January. We're also working on building out our implementation toolkit, so something like our advocacy and lobbying toolkit, but then targeted towards, you've got a bill enacted, now what? I always picture the movie Finding Nemo when all of the fish at the end are in their little bubble sacks and they're like, now what? So yes, we're going to help you guys to make sure that you know what to do with after a bill has been enacted, and now we can get to the side of implementing it and making sure that people are getting access on the ground. We're going to be upping our fundraising goals and hope to raise over $280,000 so that we can both continue to grow the initiative, but also support at the state level as well. We're launching our state coaches team, which will be introducing them here in a minute, who will be basically your core team's point of contact for So Everybody Can Move and kind of helping to increase our bandwidth. And then, as I mentioned, we'd like to host some more in-person and virtual mobility events to bring our community together and help engage more advocates and fundraise for the cause. Our ultimate goal, as many of you know, is 28 by 28. And with 2024 being a Paralympic and Olympic year in Paris, there's a lot of exciting things to come. We'd like to leverage that, but and also in aim for 2028 for the Los Angeles Paralympics coming to the US. We hope to have 28 states who've enacted this so that we can then pursue federal reform. So little by little, we are chipping things off and excited to have you guys part of this much bigger vision and goal as a team. We're working towards this. So I just want to say thank you guys so much for being part of this over the past year. So I will stop share there. And I would love to, as part of our next agenda item, is really introduce our state coaches. So state coaches, I'm just giving you a warning to put your video on if you can, and we'll be introducing you. And I'm also going to kind of pull up a little screen here. But the point of our state coaches was really, as we saw this initiative growing at a pace that it was somewhat hard to keep up with. We started, with just a few states, but now we've got over 35 state coalitions that have reached out to us. We've really wanted a way to be able to support all of you and increase our bandwidth in order to answer your questions and help guide you through the toolkit, or just be an additional resource for your team as you're going through this process. And so we've got 7 state coaches that we're excited to be able to split our states amongst, and I'm excited to have them introduce themselves to you now, and they'll kind of share a little bit about themselves, kind of their background, what they bring to the table, and then the states that they're going to be coaching. So in alphabetical order, I'll pass it off to Maggie Baumer, who is one of our state coaches.
Yeah, thanks, Nicole. And thanks so much for that slideshow. It's really incredible to see how far we've come in such a short time. It's really amazing. So thank you, and thanks to everyone for that. My name's Maggie Baumer. I am an area clinic manager here at Hanger Clinic in Massachusetts. I'm about to start a new role that's called the Leader of Enterprise Patient Advocacy for Hanger. So I officially start that in January. And that role will be focused on advocacy. So I'll be focusing a lot on So Everybody Can Move, but also some other initiatives related to access to care in different states across the country. And I am a person with limb loss. I'm missing my arm as a result of a trauma back in 2012. And we were talking on the state coaches call not long ago about, our own experiences. And I use my activity specific prosthesis every week, multiple times a week. And so when I can't use it, that definitely changes my life, and not for the better. So I'm very passionate about this cause, and being physically active was really important to me and my recovery. So I'm based here in Massachusetts, so that makes a lot of sense for me to be working on that bill, and we've made some good progress so far in our introduction. It's gone through its first committee hearing, and we're still waiting to hear about the vote on that. New Hampshire, I also have a pretty close connection with, based on geography. We're all part of the New England team here, but also in terms of my relationship with Sue Prentice, who's the state senator who sponsored the bill. And she and I had worked together as a part of another board called the American Trauma Society that Peter Thomas was on as well. And then in New Jersey, it's also just kind of the East Coast connection. I have some strong connections there through teammates at Hanger, and was interested in helping out with that group as well. So thanks to everyone for having me in those states, and look forward to connecting with you and learning more about what you've gotten going on so far.
Awesome. Thanks so much, Maggie. Super excited to have you as part of this team. And Whitney, would love for you to introduce yourself.
I use she, her pronouns. I am based here in Florida, so it makes sense for me to be the state coach for Team Florida. I have done advocacy and lobbying work in the state in my previous roles, so it was an easy fit to jump in there. A little bit about myself. I'm a prosthetist as well as someone who wears prostheses. And I actually use an activity-based prosthesis for my arm. Though my day-to-day prosthesis I wear on my leg, so I get to juggle all of the things. But I'm excited to be a state coach. I'm the Director of Government Relations for the Amputee Coalition. So if you all have any questions or anything involved about getting involved with advocacy, or more people that we can help train to bulk up your teams in your states, please let us know. But thanks, Nicole.
Awesome. Thanks, Whitney. And then Ryan.
Hi, my name is Ryan Getty. I'm the Government Relations Specialist for the Amputee Coalition. I am looking forward to being part of this state coach team in order to make this stuff happen. I'm an amputee also. I have a pretty similar story to I think Braden. I had fibular, or I suppose I still do have fibular hemimelia, which I had an amputation before I was a year old, and got my first prosthetic leg whenever I was 1. So it's been a long and fun road, and here we are at the Amputee Coalition, and I'm looking forward to making this happen. Some experience that I have before working here, I worked at the Texas State Capitol for a representative there, and my primary role there was as a speechwriter. I helped out in New Mexico and Colorado to an extent, and I'm looking forward to getting 28 by 28. It's gonna be good.
Awesome. Thanks, Ryan. We're excited to have you. And you're in Texas as well, so I think that'll be
That's right.
beneficial to the Texas team.
That's right.
All right, we've got Sam Miller.
Hello, everyone. I think most of y'all have met me in some capacity before, but Sam Miller. I am AOPA's state and federal advocacy manager. I've been here for about 2.5 years, close to. Before this, I'm a fairly recent graduate of Indiana University's Public Affairs School, so that's where I've kind of started out in the policy space, and then I've honed that since then, working on various state issues as well as some lobbying work with the federal government. Yes, go Hoosiers, absolutely, Kyle. But yeah, I'll be coaching several states this session and going into 2025, and looking forward to connecting with y'all and making this happen.
Awesome. Thank you, Sam. All right, Angela.
Hi there, I'm Angela Montgomery. I am the president of the Rocky Mountain Orthotic and Prosthetic Coalition here based in Colorado, and we were one of the successful states to pass a bill this past year. So I'm happy to help support some of the future states. I think I'm the only state lead that doesn't have anything happening in 2024, any legislation happening. So I guess I've got the easier task, but I'm really happy to get Idaho, Arizona, Utah, and Wyoming kind of headed in the right direction and ramped up to be prepared to get some legislation. So happy to be part of this national movement. And it's just so exciting to see what's happened in the last, we'll say 2 years of just the momentum, and that the map that you showed is really, really, really amazing to me. And I can't imagine that we won't have 28 states by 28. So thanks for letting me be a part of it all.
Thank you, Angela, for being part of this. And yes, absolutely. If we can hit that goal sooner and go to the federal side, that would be amazing. So thank you for being part of this and helping us reach that goal. All right, Kyle.
Awesome. Thanks, Nicole. Hi, everyone that I haven't had a chance to meet yet. My name is Kyle Stepp. I use the pronouns he, him, and I'm also a person living with limb loss. I'm an above knee amputee, and over the past 10 years, I've spent my life in the strategic partnership space and the corporate social responsibility space. And most recently, earlier this year, had the privilege of co-leading New Mexico's legislation and coalition alongside the help of our national partners, and have successfully enacted that legislation, and getting excited for January 1st, where New Mexico's bill will be going into effect. And so I'm honored to be working with Maryland, Ohio, and Indiana, I think just through my personal experiences in legislative affairs, but also having some insight and understanding into the legislative process, and specifically those 3 states, but excited to work with those teams. And thanks.
Awesome. Thanks, Kyle. And I'll also be serving as a state coach. Very excited to be focused on Minnesota. And thanks to Terry for inviting me to, come be there on the ground. I grew up and was born and raised in Minnesota. And so my limb loss journey really started there, and the lack of access that I experienced, getting access to activity-specific prosthetics really was in Minnesota. So I'm excited for this new year and going back to Minnesota, having the opportunity to potentially testify and support the team there, as it will really come full circle. I'm based in Vancouver, Washington, so I'm kind of in this perfect spot right between Salem and Olympia, so I can help serve our teams both in Oregon and Washington, so that makes a lot of sense, and help support our Oregon team to reinstate SB 797 this past year, which is insurance fairness in Oregon. And then also excited for supporting Michigan and Wisconsin. Grew up also in Michigan, went to school at the University of Michigan, go Blue. I see you, Sam. And Wisconsin as well. I have family there. So excited to be kind of wearing my Midwest hat, but then also my Pacific Northwest hat out here. As I mentioned, I bring my experience with limb loss and challenges accessing prosthetic care, that passion of mine of not receiving my first running blade until I was 26 years old, even though I'd been an amputee for 16 years. is something that really drives me and excited to bring to these teams. I've also been really working to advocate for this since 2017 and the founding of Forest Stump as a nonprofit advocacy organization. So excited to bring that experience and perspective to these states. And just want to say thank you guys so much to these incredible state coaches and to all of you. We want to be here as a resource to support you as we go through this. So with that, would love to kick it off for our state updates. And if I can bring up my agenda here, we'll kind of go through the list. And if you're on the call, would love for you to give an update. We've got Connecticut kind of as our first, and I think I saw Herb, if you're interested in giving an update. Or anyone else from Connecticut? And if not, Herb, you're muted right now, but if you're not interested in giving an update, no worries. Oh, there you are.
Yeah, I'm muted. Afternoon all, good morning to some of you. And the good news, well, I guess good news, bad news, it's a short report. We continue to reach out to the legislators. We've had some success in that regard. Most importantly, in the insurance committee itself, in the 2024 year, the only way bills get introduced is if the chairperson of the committee agrees to open the bill. It's not like in the odd years, let's say in 2023, which we were not able to get to because we didn't really get involved in this until it was too late, then any legislator would have been able to offer. But we're glad that the committee chair is on board, and better than that, my senator, state senator, is also the president pro tem, and he made clear that he is supporting this bill, and then he'll make sure that it gets introduced. That's a big step for us. So that's been our legislative activity. What's interesting beyond that is we have been encouraged to follow a second track, which is to reach out to the insurance commissioner office directly and make our plea to them that movement is medicine. And we are pursuing that particular avenue. The idea is, as has been explained to us, if the commissioner issues a bulletins telling the insurance companies that indeed recreational limbs are medically necessary in many cases, then to have that, we may not even need the legislation. So we're following both tracks. We're encouraged to follow both tracks simultaneously. And so that's what we're doing. Thirdly, we've had recent meetings. We spoke to a group of prosthetists yesterday. When I say we, I mean Connecticut Amputee Network. That was Brenda Novak and I showing up. And we were able to get their ear and to get them on board. We don't want just amputees or loved ones of amputees. We also want the prosthetists to help us promote this, not just for photo ops, but also for when the hearings begin. If we do have those hearings, that we're going to be able to engage them to show up as well and to show their support in person. One of the individuals, interestingly, is from the state of New York. And if there's anybody on this call that's in the state of New York, would you please let me know? I can put my email address there so that they can get in touch with you. That would be very helpful. I'm going to type it in now. Network. That's my email address. Because what is interesting, if you look at the map, we have 5 of the 6 New England states, or at least 4 of the 6 New England states, showing some activity, if not completion. And then there's this great big white spot to the west of us called the state of New York, which is a really big state. So we would be great if we could activate that so that it's on somebody's list. So it would be very helpful, I think, for the whole region if we can get New York State going. And I see, Peter, your hand is up. I don't know, is that for me?
Yes, it is. Herb, may I quickly interject?
Please.
I don't want to be the word police here, but I think it's instructive for the rest of the group. You use the term, you're trying to see whether recreational prostheses would be covered under the existing orthotic prosthetic benefit. I'd like to recommend that we not use that term, recreational prostheses or recreational O&P. And we similarly do not use the term I'm sorry, exercise prostheses or orthoses. Both of those are traditionally specifically excluded from health plans. And I don't think that we want to portray what we're trying to do in those terms. I think we want to stick with activity-specific prostheses and orthoses, just so that everyone on the phone. I didn't mean to call you out on that, Herb. I just thought it was an instructive kind of statement to make, and just want to make sure everyone recognizes that. Thanks.
It's helpful to know that those terms should not be used. And what terms do we use?
Activity-specific prostheses and orthoses.
Activity-specific.
I think the other way that we have talked about it is orthotic and prosthetic care, or orthoses and prostheses for physical activity. So getting rid of the adjective of how we're describing it and talking about what does it allow individuals to do. So it's prosthetic and orthotic care for, or that enables physical activity.
That's great.
But
Please
again, remember
please.
that there are, in health plans, Medicaid health plans, there are specific exemptions for exercise equipment, for gym fees, for anything that is really strictly for exercise that's not considered medically necessary. I know it sounds weird, but it's not. And so we need to stay away from the concept of this being extending into a traditionally non-medically necessary benefit. We're viewing what we're talking about as already covered. These are prostheses and orthoses that are used for physical activities, for activity-specific activities. And that's the language we really need to try to use constantly, drill into our heads and correct people when they don't use the proper terminology, because as obnoxious as I am right now correcting you, Herb, it could mean the difference between the state saying, no, we're not going to do this, it's not included, it's specifically excluded, or in fact, it is considered part of the benefit.
You're not being obnoxious at all. But what I really need is to have that language put into the chat window or emailed to us later. Because I can't write that fast.
Of course.
So that would be enormously helpful. And we'll make sure to integrate that into the language that we put in any of our flyers or any presentations that we make to anybody, because this is the language that we need to use.
Angela, did you have something you wanted to add to that conversation?
Yeah, I just wanted to say, so Colorado was clearly really early on in this process, and we weren't organized on a national level. And we, in selecting our bill language, really went back and forth on what the proper term was to use. And we intentionally chose recreational because we felt like that was appropriate in our state, and it was seemed to, I guess, get to the point of what, our state really prides itself. We have a huge budget on, outdoor recreation, and that word is used a lot here in Colorado in a very prideful way, I should say. So we chose it. My question to you, Peter, is now moving forward, are we trying to create continuity among the states? Because I think a year ago, AOPA was very careful to say the states can do what the states want to do. We're not dictating language. We're not dictating anything, and each state is unique. So you guys do what you think is best for your state. But has that tide turned, and now we are, as a larger organization and a larger movement, trying to maintain consistent among the states for the hope of federal language later?
Great question. The state takes precedent. Whatever makes sense in the state, you go with that. And I know that Colorado has a strong history around activity and recreation and fitness, and that's fine. the state takes precedent. But as a general rule, what we're trying to do is promote activity-specific prostheses, orthoses, or O&P care that can be used to perform physical activities. Again, you'll run into, there's a provision in the Medicaid program that specifically states that they do not cover exercise and recreational equipment or activity. That we don't want to be in a situation where we're essentially stating that we are seeking to have a non-covered benefit covered under this program. So if it works in your state, go with whatever works in the state. But as a general rule, we should try to use the terminology I'm in the middle of typing in this chat box right now.
Great, thank you all for the discussion on that. I just want to give a heads up that we are likely to go over time. So just to be respectful, if people do have to jump at the top of the hour. As we move into 2024, I mentioned that we will be having bi-monthly calls, so every 2 months, and we will likely extend them a little bit to make sure that we can all get to these great updates. I'm going to call on individuals that I see on the call to give updates. Jeff, for Utah, I know your whole team is together. I had a Utah meeting, so would love for you to give an update.
Sure thing. Can you hear me okay?
Yeah.
Good deal. So this is today actually marks our second meeting in Utah. We have currently a team of 4. We're being hosted here at the Autobot manufacturing facility. And our goal today is to get through today's meeting, also introduce Quincy to the team and to the workings that we're doing here. And then we're going to have some discussions around today's big round meeting, and then talk about our launch, our project launch event that we will have in February. So hopefully by February, we'll have some more team members added. We've identified some people, and we're looking at the scope of what kind of individuals we want to be bringing to the team, whether it's like a PM&R doctor or other medical professionals, and certainly listening to everyone's recaps of their state works. It's giving us a lot of insight of where to go. We have pretty much like a half a day planned for this kickoff meeting, and we're really super excited about it. And that's really where we're going to hit the ground, start assigning tasks and getting work moving along. So we're all very excited to be kicking off, and we're very happy to look at the new map with all the states lit up. That's super exciting to see Utah on there, as well as the other states. So that's where we're at.
Awesome. Thanks, Jeff, for the update. And I think you shared in the chat that it is your live day. Is that what you shared?
Yes.
Yes.
It's
Amazing.
my live day 15 years ago. And if you go to Instagram and search my name, be sure to look at my storyline, because there's a lot of inspiration and motivation in there for you. So please go take a look.
Amazing. Thank you for sharing that. All right, Dee in Oregon.
Hi, everyone. So Oregon will look to pass a new law or legislation not until 2025. So this might be a little repetitive because not much has changed, but we are working just on our one pager for the website. We're currently trying to understand maybe Shanice's social and fiscal or social impact report to see if we'll fill out a application to get that data by the end of December, since it's $0. And then next year it could cost like $1,200, but it looks like Shanice kind of sent an update maybe 4 days ago. So I guess we'll see. Obviously, Nicole, you're our state leader, so we get to talk about that during our meeting and kind of like navigate that next. But otherwise, we won't be doing anything major, but making, trying to get our data and then also make relationships until 2025.
Awesome. Thank you, Dee. And just to clarify that that application is unique to Oregon for the all payer claims database. So other states, don't worry about the cost or application side of things there. But yeah, thank you, Dee, for your update on that. Excited to have the Oregon team in charge. All right, so I see Autumn from Ohio.
Hello, everyone. So not too much going on in Ohio right now. It's a lot of waiting, just because we're waiting for the new year to come around for us to introduce. We're going to be following up with our primary next week to see what her exact plans are. And then we'll also be sending out an email to a list of reps that we have next week to start doing more meetings. And then the problem that we're currently running into, which we knew it was going to be a problem, is not having a lobbyist, because Ohio has a really strong insurance lobby, really strong small business lobby, and we will hopefully not get put in the insurance committee, but probably will. And we kind of need a lobbyist to help us avoid that. So we're kind of working on ways to find a lobbyist or get funding for one. We have some connections out currently, but to be determined.
Awesome. Thank you for that, Autumn. And did want to flag as potentially to get you connected with our Tennessee team. Also, Kyle, I see you're shaking your head because I know Kyle's got ideas for Ohio. But our Tennessee team had shared earlier this week a connection that they had made with Bridgestone, who's a Paralympic sponsor and is interested in supporting. And they have a big contingent and of employees within Ohio. So there might be some connection there that we can follow up on to see if we can get some funding for you guys from that perspective.
That would be great.
Thank you for the update and for your and Kaylee's work. Awesome. All right, Cheryl, and I see you have a question, and I would love to just pass it off to you too to give an update for Maryland.
Okay, sure. So I had something that could potentially help all them out, but I can give it with our state update. So our state's kind of been a little bit all over the place. On our call last month, we had just received news that our bill was not going to get introduced in 2024 because for any bill similar to this one, apparently Maryland requires the Healthcare Commission to have a fiscal impact report done. However, about a week and a half later, I received an email from the senator who we were hoping was going to be our primary sponsor, saying that she spoke to the general counsel for the finance committee and that they do want to introduce the bill for this upcoming session. So we were really excited to hear that. Since then, we have a really strong core group of advocates. But with the outreach we've done, we've been a little bit disheartened by the lack of support that we've received from the O&P companies in the state, as well as just trying to reach out to patient advocates. So we had a meeting yesterday with about 2/3 of our core group just to figure out how to really go about trying to get the word out. One thing that we decided that we're going to do, and I'll just kind of show this, but we're going to go door to door to some of the O&P companies. And we actually have these cards that we created that the QR code scan goes directly to the AOPA site for having individuals sign up if they're interested in volunteering. So we're hoping that that will help with us, what we're doing as well. But we're really looking to add a pediatric patient to our core advocate group who has a story that we'd want to share. We were supposed to have the deputy secretary from the Maryland Department of Disabilities meet with the advocates yesterday, but she was sick. So we are going to be rescheduling that. But what I wanted to mention that could help Autumn and some other individuals out. So I am a CPO. And so it was really kind of nice to hear about patients kind of giving us a shout out, but I kind of want to put it back on you guys because it's your stories that make us want to do what we're doing day in and day out, even above this advocacy effort. But as a prosthetist orthotist, we have connections with multidisciplinary clinics in the states where we work. So one of the clinics that I attend, the rehab doc is the chief of rehab for the hospital system. And he actually connected me to the lobbyist for the hospital system and basically said, this is Cheryl. Her company's been with our clinic for 30+ years. She's doing this advocacy effort. I plan to testify, so please basically do what she wants. So I have a meeting with her next week to kind of get her feedback. But my understanding is that if she's going to assist us with this advocacy effort, that is because the physician is telling her, we want your help. I don't think we're going to have to pay anything above and beyond because falls within her scope. So if there are any docs who you work with that have those connections with the hospital systems that they're involved with, I would recommend seeing if there's any way that you can get any of them involved. So again, I don't know for sure if that's how this conversation is going to go next week, but I'm optimistic. So I just think that having someone who understands the process as we get into things is going to help us out. And we do have a call with our lead sponsor in 2 weeks as well, just to get a little bit more information from her. So that was kind of a lot, I guess, but that's kind of where we're at Maryland. So one last thing. So we're also trying to build up our social media presence. So you might see that you personally or a company is going to be getting an ad on Instagram from us. Because again, we're really trying to figure out where these patients are. And so that way they can have their story shared. So if you see that, please support us. And obviously if you guys do the same, we will do that too. And John Edward might still be on the call. And if he is, if you want to add anything I missed, please feel free to hop in.
Awesome. Thank you for that, Cheryl. And I think that is a great idea in terms of the lobbyist, how we can, partner with other existing government affairs teams or lobbyists as part of this. And potentially, Autumn, that could be a recommendation for Ohio to explore. All right, we've got Terry in Minnesota.
Okay, hi, Nicole, thank you. And how lucky are we get Nicole? Nicole is our state coach, and how lucky are we? I just can't say that enough. Okay, so Minnesota, I'm gonna try to keep this quick. We are on track for the start of the session in February. We're probably gonna have 5 to 6 pretty short weeks to get through all the committees, but we've got a lot of support from the governor's office and from, of course, our authors. We were able to get through our fiscal process with our Commerce Department. The 62J, they're creating a report. And so we were asked to submit public comment and letters, and we were so fortunate to have our national organizations, the 4 of them sign on a letter, a really nice, very well drafted letter, very informative. And then our state society, MSOP, also was able to send a letter, and a few others, Wiggle Your Toes, our nonprofit amputee group. And then we had some practitioners. And so it was really great. So they're in the process of creating that, the Commerce Fiscal Report. We're anxious to see how that comes back. And that's basically saying, that there's a need. We also are very fortunate. We have a school here, 2 schools, Century College for the O&P assistants and technicians and the bachelors. And then we've got Concordia University, where they confer the masters for O&P. So we've got a group of honors students that requested a grant, and they are in the process of doing a video production so everybody can move Minnesota. So that's something that, if you've got a school in your area and you've got some students who, are willing and anxious, this was their idea, not ours. They came to us, and we're super excited to see how that comes out. Let's see, we've got Sam and Nicole, thank you both. We just asked really this week if we could get one of the constituents letters, the form letter by link, where you just go in and put your name and address, and the content appears and the form letters go out. So we were able to just receive that from them. So we're getting that ready for January, so we can, go out through social media to make sure everyone and anyone in Minnesota can write to their local legislators. With regard to activity-specific devices, this has been a little bit challenging. Peter made note of it, and I just want to say I'm glad. I think it was Angela spoke up from Colorado, because it's important to know what the culture is in your state and what the feel is in your state. We're doing activity-specific devices. We're also doing the showering and bathing, and there's an argument to be made. One of the legislators said to me, "Aren't those already activities of daily living?" Like, we're all about the ADLs on the reimbursement, the utilization review, prior authorization side, with the ADLs. So, one of them said to me, "Well, isn't, movement is medicine." That's what you're saying. So you want to be active. So activity specific recreational devices, these are devices that really, in his opinion, already are activities of daily living, as are showering and bathing. So with regard to showering and bathing, if any of you, Minnesota, we are including it, and any of you are interested, we picked up on that because Arkansas did it, and we had a conversation with Francois, who told us that it wasn't their idea, it was their legislators' idea to say, hey, let's add this because I think it's more important than the activity specific. So we did, it's part of our bill, and no one's asking us questions about the showering and bathing. It's pretty much an automatic, and that's what he said happened in his state as well. So for anyone interested in that, feel free to talk to Francois, or you can follow us to see how it's working in our state. Let's see. And, the whole idea is we're breaking down barriers for access to care, right? So turning these, the language that we use, it's good to be consistent, for the national movement. But that's the whole point, is we're breaking down the barriers for access to care. And historically, the access to care has been, those barriers have been these activities of daily living and not allowing for recreational devices. So it's just something to consider, something to see if you can craft the argument and create the defense. And again, when you talk to these legislators, they're amazing. Like Francois, it was his legislator that brought up showering and bathing. For us, it was, my legislator that said, aren't these already activities of daily living? So there are arguments there to be had. And then the last thing I want to add is, I just want to make sure when you're creating model language, we were so fortunate to be able to get ours, quickly and get it in, but we did miss language. So there was language missed. We missed it, our lobbyists missed it, because we thought the language was strong enough for the state plans, Minnesota Medicaid and MinCare specifically for us. So we got on the phone and we talked to our Minnesota Medicaid, and they're 100% in support of this. They said they're helping us draft the language, the amendment language, because they feel that it's important to make sure the state plans are in this as well. So it's just really interesting to see along the way the help that you receive. I want to be conscientious of time, so I feel like I've just ran a marathon and speaking as quickly as I did. But thanks to everyone, and thanks for the opportunity to update, and looking forward to continuing to work with all of you in Nicola, Minnesota. Thank you.
Awesome. Thank you so much, Terry. And I love that you used the language of movement is medicine. Our official tagline is empower through movement, mainly because movement is medicine is already trademarked, but we would love for you guys to continue to use that language as well. I think that really does hit home with legislators when you share that movement is medicine. It really gets the point across. All right, we've got David in Tennessee, or Joseph, whoever's still on the call.
I'll go ahead and I don't know if Joe's still on it. I'm here. We had our first meeting as a state coalition yesterday. Nicole was part of that. We appreciate the support that we're getting from the higher ups to get the ball rolling. We've got a really good opportunity next week. We're meeting with our sponsoring legislators, our lobbyists in place, and he's got previous literature from previous bills that were submitted. So we feel like we're in a really good position for this upcoming year. As you mentioned, the opportunity to partner with Bridgestone was presented to us. So we're going to hopefully be meeting with them next week. And just it kind of hit a flick in my brain from my previous life of working in corporate America and Fortune 500 companies. My recommendation or advice, of course, we don't have any success yet, but I would strongly recommend every state to look at the manufacturers that are in their states. Procter & Gamble is one of the international sponsors for the Paralympics. They are based in Cincinnati, Ohio. Toyota is a partner. We have 3 facilities in the state of Tennessee. When I worked for General Mills, every single employee of General Mills had the opportunity to receive a $3,000 grant for an organization of their choosing. So Georgia, Covington, Tennessee has a General Mills facility there with about 200 employees. So you could multiply 200 times 3,000 and you could fund a lobbyist pretty easy. Obviously, you'd have to get everybody to sign on, but there's also, I'm sure Procter & Gamble, all the facilities, companies like that have that type of thing. So hopefully that'll make fundraising easier for everybody to look at the corporate world and reach out. So that was a little plug there for just everybody. But back to Tennessee, we have really good momentum. We're very excited what we have forming and what we feel like is a relatively short period of time. Joseph has been doing a lion's share of the work behind the scenes, getting phone calls, getting appointments in place, and talking to people. And we have a very strong coalition that's formed.
Joseph, do you want to add anything?
David, I think you said it all. We have an incredible group that we're working with in Tennessee, and I'm just so honored to be working with all of you around the country and hearing your stories and hearing the work. It's inspiring. And I think, we learn from one another by what we're doing. So just so glad to be a part of this broader effort and just appreciate everyone's work.
Amazing. Thank you both. There's a strong team in Tennessee. We're excited for you guys. All right. I think, Maggie, you kind of gave an update for Massachusetts, but I didn't know if you had any additional updates.
Not a whole lot. Yeah, like I said, our bill has been introduced and heard by the Joint Committee on Financial Services. So we're just waiting to find out how they vote on it. And it was predicted that it would then go to the Ways and Means Committee if it's approved by the Financial Services Committee. So we have recently, though, I did ask Sam for some data from the Phone to Action website, and we have seen a big uptick on the number of people that have submitted emails to their legislators. So we're getting a lot more action there, which is great to see. So yeah, we're in pretty good shape and just waiting to hear on those results.
Awesome. Thank you, Bat. And then last but not least, Sam Miller is going to take the update for New Jersey since Steve Slowinski wasn't able to be here.
Yes, absolutely. So earlier in November, I had a chance to travel to New Jersey for their Academy chapter meeting presented on so everybody can move to a fairly large audience and really got the word out about the initiative. I thought it was pretty well received, so that was really exciting. They have their own letter writing campaign, similar to the ones that Maggie and Terry mentioned. It's doing pretty well. That's being promoted via like LinkedIn and Facebook as well. The goal of this at the moment is to have the Commerce Committee add the bill to their kind of hearing schedule. Steve's been working with the chief counsel of the committee, who is talking about the bill with the committee chair. So that's a really helpful way to make sure that happens. For all of you, once your bill kind of starts getting assigned to a committee and you're starting to move through that process, reaching out to the committee staff is the best way to make sure that it's heard well, received positively, or added to the docket. Steve's also doing some great outreach with some community advocates in the state. I believe that he's talking with Jane Havsey, Kelly Worrell, and then also a patient advocate, Quinn Edelson. She's a pediatric patient. So that's pretty much what's happening in New Jersey. Nicole, is there anything else that I missed? I think that they're also working with another advocate, pediatric advocate, Logan, as well. I think that's everything.
I think you covered it all. That was great. So I think unless I missed anyone who wants to give an update or question, I know we've gone over time. We'll, for the new year, be having bi-monthly calls. I'll extend them to about 1 hour and 15 minutes since that seems to be the amount of time that we've taken on each of these to make sure we have updates. If anyone else wants to share anything, would love
Kentucky's on.
Oh, Megan, yeah. Oh, I'm not sure if you were sharing something.
Yep, sorry. So Kentucky, our draft is done. We're looking to introduce it in the upcoming next couple of months. We are meeting with a potential sponsor next month. We met with one potentially, but she does not think it would go very far if we went with her, just because she's a Democrat and our house is mainly Republican, so she's thinking that if she introduces it, it's just going to be knocked down pretty quickly, even though it's a bipartisan issue. So we're trying to find someone that would want to sponsor it, but she said she'd help any way she can. And then as well, we have a day that we are going to be probably going up to Frankfurt and meeting with anyone. They kind of like a caucus day. So we're going to get some of our patients to go up there as well. And then our fact sheet is pretty much done. We've had multiple patients submit all of their stories to that, so we can present that as well.
Amazing. Great update. Thank you for that, Megan. All right. Well, thank you all so much. This has been a fantastic update and a way to close off the year. I want to thank you all for the effort and work that you've done in 2023, and we will see you in 2024. So thank you guys so much. All right. Bye,
Thanks,
everyone.
Nicole.
Thanks,
Thank you,
Megan.
Nicole.
Thanks,
Bye.
everyone.